Good evening and welcome to our webinar entitled Fear and Loathing on the Way to Leveling the Playing Field. I'm Karen Richter, co-president of PSARA. For those of you new to PSARA, we're a multi-generational organization with over 1,500 members who advocate for seniors, their children, and families. We support efforts to allow all people to live their lives with economic security, dignity, and respect, and in a clean environment. I encourage you to visit our website, PSARA.org, and we are strongly asking you to sign on to our letter to President Biden, asking him to level the playing field between traditional Medicare and Medicare Advantage, which is the topic of our webinar tonight. We're very honored tonight to offer our webinar featuring 5 national experts on the privatization and corporate takeover of Medicare. We'll have time for questions after their presentation, so please put your questions in the Q&A and not the chat, because we won't be monitoring the chat. Our webinar is being recorded and it should be available on our website, PSARA.org, in just a few days. And while you're on our website, please consider joining us if you aren't yet a member, and check out our upcoming events and save the date in particular for June 15th, which is our Juneteenth event with the Washington State Labor Council. I'm going to make a brief introduction of our panelists in just a few minutes. Then my co-president, Jeff Johnson, will provide an overview of PSARA's Level the Playing Field strategy. And then each panelist will get a few minutes to respond to several questions that Jeff will pose to him. And then we'll have the opportunity for our questions and answers. So we feel very honored tonight to have each of our national experts with us. Each is doing a really excellent work with their respective organizations. Dr. Ed Weisbart is the National Board Secretary of Physicians for a National Health Program and chair of the Missouri chapter of PNHP. He's an expert on the topic of the consequences of the threatened corporate takeover of Medicare. Wendell Potter is the editor-in-chief of Healthcare Uncovered, an outstanding source of information on the profit-driven practices of the insurance industry. He's president of the Center for Health and Democracy, which advocates for sweeping healthcare reform at both state and federal levels. Roach is the former executive director of the Minnesota Nurses Association. She presently serves as the national coordinator for the Labor Campaign for Single-Payer Healthcare and the chair of Healthcare for All Minnesota. David Lipschutz is the associate director of the Center for Medicare Advocacy, and he is based in the Washington, D.C. office. David engages in Medicare policy and coverage issues on behalf of Medicare beneficiaries. Spencer Carnes is the organizer for Be a Hero, a healthcare justice organization that amplifies the voices of people directly impacted by the greed of corporations profiting from the U.S. healthcare system. So please, everybody, join me in welcoming our panelists. And Jeff, over to you.
Well, thank you very much, Karen. And thank you, PSARA members and guests, for joining us for this webinar tonight. And thank you, participants, for lending us your time and your expertise. We really appreciate it. So PSARA has worked with all the speakers that we have here tonight. Some have written articles in the Retiree Advocate. Some have participated in previous webinars. But most importantly, we have learned something from every one of the participants on here as we all work together to try to reverse the impacts of the privatization juggernaut that's trying to destroy traditional Medicare. So PSARA, for the past 3 years, we've had campaigns to try to protect and strengthen traditional Medicare. You know, we started with trying to stop the ACO REACH pilot program that went into effect on January 1 of 2023. Last year, we began educating on the abuses of on the health of seniors and the differently abled through privatized Medicare. And now we have a campaign around leveling the playing field between traditional Medicare and privatized Medicare. You know, and the truth is the stakes could not be higher. Should Trump and the MAGA Republicans win the 2024 elections, traditional Medicare, for all intents and purposes, will end. President Biden, in his State of the Union address, drew his line in the sand. He said that if anyone here tries to cut Social Security or Medicare, I will stop them. Now, that's a great start. That was a pleasure to hear. And I know PSARA members and others were clapping as they heard that. But while it's a good start, the threat to traditional Medicare is much more pervasive than just stopping cuts. I want to quote from Congressional member Pramila Jayapal, the head of the Congressional Progressive Caucus. This comes from the recently published Medicare primer that PSARA put out, entitled "Give Us a Real Choice, Level the Playing Field Between Traditional Medicare and Medicare Advantage." And her quote, here's what Pramila said in her foreword to the piece. "Over the past several years, there's been a gold rush to privatize Medicare. If we don't level the playing field between traditional Medicare and privatized Medicare, healthcare decisions for seniors will be completely at the mercy of corporations by the end of the decade." Given the enormous amount of money being spent on Medicare each year, which is estimated to reach about $1.6 trillion annually by 2028, private industry is focusing on making Medicare their next great profit center. And they already have a huge head start on doing this, with the excessive overpayments that they get from CMS, with their ability to offer low to no monthly premiums, with their ability to offer additional benefits not available to the beneficiaries on traditional Medicare, their practice of delaying and denying claims, and the fact that there is little to no accountability cracking down on fraudulent practices that bilk the Medicare trust fund of tens of billions of dollars a year. Since PSARA doesn't have an army of K Street lobbyists, nor do we have much in the bank account to go up against corporate America, we developed a campaign strategy taken straight out of, a freshman college year's economic textbook. In the name of competition, we say, let's level the playing field in terms of costs and benefits between traditional Medicare and privatized Medicare, and allow seniors to choose which makes the most sense for them, traditional Medicare or privatized Medicare. Let's give seniors a fair choice for the first time between those two types of programs. What does leveling the playing field actually look like? Well, to us, it at least means eliminating Medigap insurance. This was, when the Medicare Act passed in 1965, was in part a concession to the private insurance industry. But in part, it was part of the racist bargain made with Southern senators, because Lyndon Johnson and the Democrats said, look, in order to receive Medicare payments, you have to accept all comers to your doctor's office and hospitals. That didn't sit so well with Southern senators. And so Medigap, 20% of Medicare costs were not covered. So either you paid out of pocket or you had to buy Medigap insurance. Well, for all intents and purposes, for many poor people, both Black and white, it made Medicare unaffordable. That same stumbling block exists today. Another part of leveling the playing field is placing an equivalent cap on out-of-pocket expenditures. Another piece of it is equalizing the benefits offered in privatized Medicare programs for vision, dental, hearing, transportation, gym memberships, and the like. Another part is putting an end to the excessive overpayments to privatized Medicare from CMS, as well as the fraudulent practices used by these privatized companies managing our Medicare claims. And then using this money to create the equivalency between traditional Medicare and Medicare Advantage, or using these billions and billions of dollars each year to fund leveling the playing field. Now, we believe, given a level playing field, that seniors will increasingly choose traditional Medicare over privatized Medicare. And it kind of makes sense, right? I mean, given how important healthcare decisions are, wouldn't you rather make your healthcare decisions between you and your attending physician, rather than having a third-party intermediary step in and say, yes or no, or delay your care, or even deny your care. Also, given that those on traditional Medicare have access to healthcare anywhere in the country that accepts Medicare payments, you have that expansive choice before you of where you receive your healthcare rather than limited, networks that the privatized companies have. And then finally, if we level the playing field, there's going to be no arbitrary cost impediments to those on traditional Medicare. My wife and I, pay quite a bit in our Medigap insurance each month, and we can afford it. But the majority of folks in this country can't afford those high rates, and it creates a false incentive, or it creates an incentive to go with a privatized plan where there's low to no monthly payments. So our campaign at PSARA, we figured, look, since we don't have those K Street lobbyists and we don't have a big bank account, what we rely upon is getting as many in-state and national organizations and as many community, labor, religious, social justice leaders to sign on to a letter that we have put out, and it's on our website, as well as a resolution for organizations calling on President Biden as the leader of the Democratic Party to lead the charge on leveling the playing field, to protect and expand a legacy that has been part of our democratic and social justice tradition. So that's really what our strategy looks like in a nutshell. It's not very complicated, but it's saying, hey, look, if you believe in competition, let's level the playing field. Let's make it truly competitive and give seniors and the disabled an opportunity to make a fair choice. So that's where we're at with our piece. And I wanted to ask just a real straightforward question to our experts, how they, what they understand of our level the playing field strategy, what they think about it, and how it fits into their organization's plans. How, if they have disagreements with it, how we might strengthen the level the playing field strategy. So I'm gonna be quiet now and turn it over to the folks that really know what they're talking about. And so I know, Ed, you said that you might have to go back and forth. So why don't we start off with you?
Yeah, hey, thanks, Jeff. And first thing I have to do is just applaud PSARA for putting together these sessions and doing really the hard work and the heavy lifting and the terrific new primer. If folks on the call haven't seen that yet, make sure to get your hands on it. It's a terrific discussion about what's going on in healthcare. So the second thing I want to say is that advocacy works. The stuff we're doing tonight, the community education, these kinds of discussions where we all learn, that works. And it works better when it's not a solo effort, but when it's a team sport, when we all work together. So there's a number of new things along that line over the last several months, or maybe a year or so, and then some particular new things this week. So the new things over the last year, to sort of make sure we all realize that and celebrate this, is that we have worked more or less in silos for decades. Not completely, we talk to, I wrote, and we have talked to each other, but not as closely as we have the last year. So there's an informal new sort of coalescence of advocacy groups. Hats off to Be a Hero for convening it initially and kind of doing some of the heavy lifting there, but it includes groups like Social Security Works and Public Citizen, Center for Medicare Advocacy, Center for Health and Democracy. I have to look at the list because there's a lot. I'll probably forget people, so I'm going to stop there rather than. So it includes friends and allies and people that really, it's great working together. And I think we've all largely settled on what Jeff described as the level of the playing field strategy. And it's interesting that I think we've all kind of come to that through different pathways, but gotten to the same point. So I'm here from PNHP, Physicians for a National Health Program, and us, we've been laser focused on single payer Medicare for all for 35 years now. But let me just sort of say what I've said to people in Congress when I've had the chance. Us, PNHP, we're about this key topic, but whether or not you agree with the single payer strategy and as a policy, you probably do agree that Medicare itself is precious, that we shouldn't let anybody raid the Medicare Trust Fund, and that a good healthcare care program should help people and not hurt people. So that sort of is the structure for what we've been working on. To kind of give you the sense of the bits and pieces, you saw from us last year a report about the finances of Medicare Advantage and how it's as much as $140 billion in 2022 that was being rated from the Medicare Trust Fund. And so whether people in Congress agree with PNHP and others about single payer, everybody's kind of horrified about that number, how big that number is. And PNHP is no longer the only group saying that number. There's other groups out there that have done similar analyses and come up with comparably big numbers. And it's really important because it was a much smaller number that was getting bantered around. It was just the overpayments from upcoding. And so people in Congress could kind of pat themselves on their backs for trying to deal with upcoding in Medicare Advantage. But there's so many other pieces of how these corporations are ripping us off. So it's great being able to get people to start using more complete numbers, which creates the opportunities that Jeff was talking about to fund things. So what does level the playing field mean to us? It means just what you said. It means first and foremost improving traditional Medicare, add in the missing benefits that didn't seem as important in 1965. Okay, add them in now, a hearing, vision, dental, and all of that stuff. And most importantly, fix the problem that drives people into Medicare Advantage. Rather than having the corporations be able to raid these funds, put that money into eliminating the copays and the deductibles, or at least greatly mitigating them, ideally eliminating them. Even if the federal government ran a Medigap program, that by itself would be cheaper. So traditional Medicare has an overhead of 2%. Medigap companies have an overhead of 22%. So just having it be federally run would probably be a lot less expensive. You could do that, and you could build it like you do in the ACA with premium adjustment based on income. So you could just eliminate the copays and deductibles. So one of those ways forward, we need to get rid of the financial barriers to traditional Medicare. That's the key to making a fair, equitable, just healthcare system, and it's frankly the key to putting an end to the profiteers, because that's the thing that's driving people into it. So, so our concept is exposing the overpayments and the rating of the funds, and exposing the harm. So we did the overpayment report last year. Sometime in probably late May, PNHP is going to release a new comprehensive report about the harms done by Medicare Advantage, and then we'll announce that we'll discuss that during a webinar in June. So keep your eyes peeled for that. And I just want to again thank PSARA for doing all of the hard work. But there is new news this week that proves my point that advocacy works. And I'm not going to steal the thunder, but I just wanted to make that point. And I think I'm turning it over to Wendell, who can talk about that and a gazillion other brilliant things that Wendell's so genius about. Wendell.
Oh, thank you so much. It's wonderful to work with Ed and everybody on this call as coalescence, as we collectively call ourselves. It seems as if we decided that coalition is not the appropriate word, or it's an overused word. And there's some merit to that. Coalitions are a dime a dozen in Washington. So what we're doing is refreshing. I'll back up though, and say that I think PSARA's strategy, its plan, level the playing field is brilliant, to be honest with you. I think it's a right approach. It's very thoughtfully done, and I think it's achievable. And I think it's achievable if we do, as Ed was talking about, work with others in this space who have in one way or another been working to improve, if not expand the Medicare program to cover everybody, improve it and expand it to cover everybody. And I think it's entirely possible. The news that Ed was alluding to was the fact that I honestly think that it's because of the meetings that we were able to get with in-person meetings with Secretary PSARA and leaders at CMS, later with top people in the domestic policy office at the White House. We made it clear that we're not going to let private insurance companies take over the Medicare program, and they listened to us. And this is the first year and David might correct me if I'm wrong, but at least in recent memory, in which the proposed rate increase that CMS had announced a few weeks ago. They do this annually about what they anticipate medical trend to be in traditional Medicare and what that translates to and what they need to, in their opinion, give private insurance companies to operate the Medicare Advantage program. They held fast. They didn't, despite industry pressure, and I can tell you it is absolutely intense. And these companies have enormous sums of money to apply that kind of pressure and threats, political threats. It can be implied or direct, depending on the kind of meeting that they're in. But CMS held the line. They did not bend this year at all to the pressure from the industry. It actually is a bit of an increase, but it is an increase that is, again, based on the expectation for medical trend. And one way of looking at it, it's an actual decrease in some regards to what the previous payments have been to Medicare Advantage plans. It doesn't solve all the problems by any stretch of the imagination. It will not solve the problem of overpayments. It might reduce them. There's plenty of work yet to do. But these companies have been making money hand over fist, as I think we all know. Today, I published an analysis of the profits, the revenues that these companies, the big 7 companies that are for profits, all of them traded on the New York Stock Exchange, looking at how much money they pulled in just in one year, last year, over $1.25 trillion in revenues. And they made almost $71 billion in profits, just these 7 companies. They're not the only players in Medicare Advantage, but they're the largest, and they include United Health, Humana, and CVS Aetna. And they have signed up the lion's share of the new enrollees because they're so aggressive going after these newly retired beneficiaries, or trying to convert people from traditional Medicare into these Medicare plans. There are real consequences to that, not only to us as advocates, but to investors. And I watched to see what happened on Wall Street today, and it was absolutely remarkable. In my old job at Cigna, I used to handle financial communications, and I knew when we announced quarterly earnings, if Wall Street wasn't happy, that we were going to have a very, very difficult day. I can assure you, the CEOs, the CFOs, the investor relations teams, the communications people at these companies, they had a horrible day today. Humana lost over 13% of its value. Today, 52 million shares of stock in these companies changed hands. All of them lost value. And I saw an article just a few minutes ago in Barron's, which was the most savage report I have ever seen of a company in this space. It was just absolutely brutal. Humana, just a few weeks ago, its stock price was over $500. It's now just barely over $300. And the whole gist of this article was that Wall Street has fallen out of love with Medicare Advantage. I can't emphasize the importance of that enough. So these companies are in a real tight spot. As they in the coming months, they're going to be having to submit their rates or their proposals for 2025 to CMS. This is how much they will charge, what their benefits are going to be, and they have to do it in a way that continues to try to mollify or please Wall Street, but also to be able to attract new enrollees. So we're at a position, I think, with the industry being more vulnerable than it ever has been. And so your strategy, I think, is timed right. And I think we've got this coalescence that's come together, and we're not going anywhere. There's a lot more that we can do. Over recent weeks, we have focused on this rate increase, or this advance notice and the rate increase. That's behind us now. And so there's more work that we can do, and I really look forward to working with you all at PSARA and other groups. I think there are more people that we can bring into this work to level the playing field. That's got to be essential. And I think that everything that Jeffy said is absolutely true. And I'm glad you gave the history, or provided a glimpse of the history of how the Medicare program came to be the way it is. It's still, these companies are still taking advantage of people of color. They target minority communities. communities that are less able, certainly, to afford Medicare supplement policies. And that's a message we need to carry to the Congressional Black Caucus, to the Hispanic Caucus, and others. And over the past year, I've had more than 100 meetings in person or by Zoom with congressional offices, many members, but mostly with staff. But we're making our voices heard. And I'm not going to say for the first time, but the first time working as part of an organized group. And I think there's some parallels to what happened in 2009 and 2010 when groups came together. I know PNHP was not a part of that one at that time, understandably. But it was, I mention it because it was a broad-based group of organizations and labor unions that really came together that was able to push that legislation forward. Without that, it never would have happened. As I wrote in my piece today, it has many, many flaws, but it has done some good. But that's how you can move the goal, not move the goalpost, move the ball down the field. And I think that what you all are working on, what you put on the table, is absolutely the right way to go. And with that, maybe should I shift it over to David, or where should we go from here?
So I want to do some gender balance. I'm going to ask Rose if you all don't mind.
Absolutely.
All right.
Well,
and Ed, thank you.
Sure. Thanks, Jeff. Good evening, fellow patients. Thanks to PSARA for this opportunity tonight. I want to sort of tackle this from a labor perspective, and to start with kind of the question of where are we right now in the fight to stop this corporate takeover of Medicare? And the answer is we're not where we need to be, but we are moving, and we are moving in the right direction. The corporatization and privatization of not only Medicare, but of our entire public health infrastructure, to say nothing of our healthcare system itself, is a complex issue, but the question is, does it need to be? The answer is no, it doesn't need to be that way. But getting from that complex, convoluted, fragmented, and therefore really costly system where the moneyed vested interests profit off of human suffering to a system that's centered on patients and providers takes political courage and political will, and we're not quite there yet. So we need you all involved in this campaign with us. The fight to stop the corporate takeover of Medicare has really made some great strides, I think, as everyone has already mentioned over this past year. Thanks in large part to the work of PSARA, the organization I'm representing tonight, the Labor Campaign for Single Payer, has taken up the mantle of educating, agitating, and organizing trade unionists around the need to protect and save our Medicare program. We do that by calling out the bad actors, those private insurers, also known as Medicare Advantage, and, as you've been hearing, leveling the playing field between those Advantage plans and traditional Medicare. And let's be clear, Medicare Advantage is not Medicare. It is the misleading name given to private insurance companies that get taxpayer dollars from our Medicare fund to provide enrollees with a private insurance plan. That's why I just refer to them as Advantage plans. So it's important for us to remember, we hear a little bit about the history of Medicare, but remember, when Medicare and Medicaid were enacted in 1965, part of the reason was because insurance companies didn't want to insure old and sick people. Well, they certainly have had a change of heart about that, haven't they? And that's all about the money, of course. So what are we going to do about it? Well, we know that many retirees are on Advantage plans, so simply demanding an end to those plans is probably unrealistic, but we can and must push to recapture those dollars that are fraudulently going into corporate healthcare bank accounts, shareholder dividends, and CEO compensation packages, and use that money to improve traditional Medicare so that the enrollees with traditional Medicare, which, as you have heard as well, costs a little bit more because of that supplemental or the Medigap plan, it can be a real financial option when it's compared to Advantage plans. We could use that money to cap those out-of-pocket costs, strive to get Medicare, traditional Medicare, to covering 100% of costs, and expand benefits so that we're covering things like hearing, dental, and vision, which are, by the way, all part of our health. This really has been a winning strategy to raise the scam that is healthcare privatization, while also recognizing the need to push back in a way that protects retirees' access to healthcare. The level the playing field resolution that was alluded to earlier has been passed by the Washington and the Minnesota, which is where I'm from, state labor federations. It is the foundation to beginning this important discussion inside the House of Labor about these disadvantage plans and why labor should fight against this egregious privatization. That's why the Labor Campaign for Single Payer is working to get state feds across the country to pass a similar resolution so that labor can take a stand against the corporate takeover of our Medicare program. Labor should not promote the privatization of Medicare. We really need to find a better way to ensure an affordable and healthy retirement for workers. So where do we go from here? Ultimately, we need an improved, expanded Medicare for all. The Labor Campaign is founded on the principle that we must take health benefits off the bargaining table. It's a failed strategy to think we can bargain health care. Our employers should not control our access to health care. They use it as a weapon to divide and conquer us, and they bludgeon us with it when we exercise our right to strike, wherein if you're not on the payroll, you lose your health insurance benefits. You lose your job. You lose your access to health care. Labor must continue to build relationship amongst workers, listen to their stories, find common ground based on our union values that an injury to one is an injury to all. Education on this important issue is key. Let's move beyond resolutionary politics and into revolutionary politics by taking this issue up as an existential fight, prioritizing it politically and resourcing it. Once we do that, we will win true healthcare justice for all. Trade unionists, here's what you can do to help advance the campaign to stop the privatization of Medicare, to protect it, and to win healthcare justice for all. Schedule a training session on Medicare Advantage within your union local. Push your union leadership to invest in an internal campaign to educate the rank and file members on this important issue. Work with the Labor Campaign to bring the level the playing field resolution to your union, to your state federation, and get on our mailing list. Encourage your union to become a Labor Campaign affiliate and stay engaged in our work. Labor is uniquely positioned to help lead the way in the fight to protect Medicare by leveling the playing field and begin building the infrastructure that we are going to need to ultimately win an improved and expanded Medicare for all. It is our moral imperative to do so. Will we stand with the corporate bosses, or will we stand with one another? I know where I'm standing. Fighting for healthcare as a right is the ultimate act of solidarity. This is about our common humanity. Health is public. It is a necessity, not a benefit to be negotiated. It's the right strategy. Si se puede. Thank you.
Thank you, Rose. That's great. Spencer, how about giving us a sense of what Be a Hero thinks?
Oh, I'm happy to, Jeff, but I didn't realize I was going to follow Rose. Yeah, si se puede, Rose. All right, well, I want to start off by saying thank you to PSARA for inviting me to speak tonight at this panel, alongside so many experts and just truly legendary organizers in the movement for healthcare justice. And I also want to express my heartfelt, sincere appreciation to PSARA for dedicating your primer on leveling the playing field to our organization's founder, Adi Barkan. Adi passed away last year, and Robbie and PSARA was kind enough to send me a hard copy. It means a lot to have the dedication be to Adi. And Adi founded Be a Hero because he knew that by sharing our stories about the broken healthcare system, we could inspire people to participate in change, and we could put profits over people. So now Be a Hero is led by Dr. Jamila Headley. She herself lives with a disability, and she knows all of the ways in which our broken healthcare system is failing patients. Our organization is really focused on lifting up the voices of people who are directly impacted by inequity in Medicare Advantage. And so we're working really hard to share the stories of people who are experiencing delays and denials in getting care. We believe that by sharing these stories, we can foster a sense of solidarity and urgency around creating a political solution to this problem. And that political solution is leveling the playing field between traditional Medicare and Medicare Advantage. Excuse me. Got something stuck in my throat there. Ooh. So not only is traditional Medicare unwhole in benefits, but it's largely unaffordable to many older Americans and people with disabilities. 47% of people who are on traditional Medicare don't have dental coverage, which is a big surprise to me because I thought it was a program that just gave you healthcare for everything you needed once you turned 65. At the same time, rising premiums in Medigap policies are making traditional Medicare just unaffordable and leaving a lot of Americans with no real meaningful choice. And at the same time, our solution also needs to work to protect people on Medicare Advantage from harms. Limited provider networks and prior authorization and the auto denials of care are leaving millions of people suffering in silence. And so when I think about the question of where are we in the fight to reclaim Medicare and level the playing field, well, from my perspective, our movement has grown exponentially, and that really is evidenced by CMS's decision yesterday. We're going toe-to-toe with millions of dollars of spending by the insurance industry. So I'm going to roll out some numbers here, and these are just numbers that I know. But since the start of 2024, activists within our coalescence have sent over 70,000 emails to members of Congress. They've made over 10,000 phone calls to their representatives and senators. They've submitted over 27,000 comments to CMS. They've delivered 30,000 petition signatures to President Biden, and they've met with over 50 congressional offices to talk about this issue. And that's all of that work is backing up the meetings that Wendell and others are having in DC to make our voices heard. And our alliances are definitely growing, and they need to continue to grow. Organizations like Be a Hero and PNHP and the Labor Campaign for Single Payer are working really closely with the New York City retirees who are currently fighting back against being forced into Medicare Advantage. And in 2024, we want to continue to build relationships with more retiree networks and more activist organizations to grow this movement. Because if we're going to win, we're going to need a big multiracial, multi-generational movement of activists who are demanding a level playing field when it comes to Medicare. So what's next? Well, I think we also need to recognize that there's a lot of work that still needs to be done when we are, there's a lot of work that still needs to be done to educate people on this issue. We've had meetings with elected officials and their staff, and it's pretty clear that there's a lack of knowledge about how Medicare even works and like what's not included in traditional Medicare. And I have conversations all the time with dedicated activists, and many of them say, I'm really worried about Medicare being privatized. And they don't really realize that Medicare is already 51% privatized. So this year, we need to find creative ways to educate more people about this issue and galvanize them into the campaign to level the playing field. PSARA has done a lot of really excellent work on education, such as the primer. And I also remember there was an event last year called Pirates of the Medi-Caribbean, if I remember correctly. And I remember seeing Rick Timmons dressed up as a pirate. It's one of my great memories from this fight. And that's the type of localized creative organizing that we need to replicate across the country. Rose has also been doing some really awesome work in the labor community to educate people about this issue. And we need to continue to find ways to meet people where they're at and bring this issue up in kitchen tables across the country. So just to kind of summarize where I think we're at, we need to continue to tell people stories about the harms of Medicare Advantage. We need to talk about the shortcomings of traditional Medicare, and we must actively work to build a multiracial, multi-generational movement to level the playing field. And we need to educate our friends, our families, our followers, our neighbors, and our elected officials about what's at stake here and what we can do about it. And I'm just very thankful to be in community with all of you and thankful to my fellow panelists. So I'll pass it back to Jeff.
Spencer, thank you very much. So David, you get to back cleanup, which is a really good position, but also when we do general Q&A, you get to go first, okay? So
oh boy,
David,
okay. Great, well, thank you. I think thanks to PSARA and you, Jeff and Karen, for the invitation tonight. I'm so thrilled that these issues are getting more attention. These are issues that we at the Center for Medicare Advocacy have been working on for years. And much has been said, so I will keep it brief so that we can get to some of those questions. But to echo the points that have already been made, I think leveling the playing field is exactly the right tactic. I say that in part with humility. It's one that we've tried to convey and use for many years, and tried to point out the inequities between Medicare Advantage and traditional Medicare in payment, in coverage, ease of enrollment. And I think it's a concept that appeals to basic fairness rather than, I think to Rose's point, there's going to be a lot of people already in those plans. So if we come at it with a torch and pitchfork approach, that won't go over well, as well, I think, as appealing to basic sense of fairness. The level of playing field campaign fits in quite nicely with the work that we are doing. We try to tackle a lot of barriers to care in the traditional Medicare program, but we often find that those barriers are exacerbated when it comes to Medicare Advantage. And things that would be covered in traditional Medicare are not covered in Medicare Advantage. And then you add on the additional barriers that come with Medicare Advantage, such as extensive use of prior authorization and the ability to restrict people to narrow networks of providers. And it's a recipe for disaster for Medicare Advantage enrollees. So I think the focus on wasteful overpayments is exactly right. I think equalizing the benefits is exactly right. And you say, look, yeah, Medicare Advantage plans often offer some type of vision, hearing, and dental, but it's not standardized and it's across the board. Dental coverage can be one cleaning per year, or it could be something more meaningful than that. And you make the argument that if you add vision, hearing, dental, and other benefits to Medicare, that becomes standardized. That sets a new baseline that accrues to everyone's benefit, including those in Medicare Advantage, because they'll be required to cover that as well. I would add to kind of, as far as the elements of leveling the playing field, is ease of enrollment. People can freely get in and out of a Medicare Advantage plan on an annual basis. But even when it comes to Part D plans, the rights aren't as flexible as they are with Medicare Advantage, and also with respect to Medigaps, which I do want to circle back to. But with respect to promotion of the Medicare program, with this increasingly privatized system, we are relying on people to provide Medicare advice and information who have a pecuniary interest in the outcome of your decision, rather than investing in state health insurance assistance programs, I think called SHIBA out in Washington. Most people go see an agent or broker who have a financial interest in what decision that you make. The Medicare program does not promote the traditional Medicare program enough. The incentives are completely out of whack. Now, when you ask the question about whether or not there are any disagreements with the level of the playing field, I offer none. And this comes not as a criticism, but just as a way that we would approach it, a way that we emphasize. I don't think we would put as much emphasis on eliminating Medigap plans. We share the goal of alleviating the need for them by adding an out-of-pocket cap to the Medicare program. But as long as we don't have one, and then as long as it's likely that we're probably going to see piecemeal improvements rather than a wholesale improvement to Medicare, we very likely will need Medigap programs around as a counterweight, as long as there are Medicare Advantage plans. And to that extent, I think there are ways, and Ed touched on this earlier, that if federal government offered it, it could be a lot cheaper. Maybe there are ways to promote the plans that essentially function as an out-of-pocket cap in Medicare that are not being promoted by agents and brokers because they don't get as high commissions as they do for the more popular, rich plans. So I wouldn't lump Medigap in the same insurance company category as Medicare Advantage and Part D plans, even though oftentimes they're offered by the same entity. They don't make decisions about coverage. Medicare pays, they pay. It is unaffordable, to your point, Jeff, at the outset, unaffordable to a lot of people. But I would focus more on pushing for the out-of-pocket cap, and then the need for Medigaps will go away, rather than calling for an elimination of Medigap plans. And then another thing, as far as emphasis, I would focus on I would not spend as much time on the REACH ACO program, because we know that's its predecessor, the direct contracting entity, was a horrible program that would have privatized entire counties of Medicare beneficiaries. They changed it, they made further changes, and it's going away as of now in 2026. And I think that the clear and very real present danger to the privatization of the Medicare program is Medicare Advantage. Having said that, we have a lot of concerns about the pledge to put everyone not in Medicare Advantage into some type of accountable care arrangement. And I think we have a lot of concerns that I'm assuming you all share about some of the negative incentives that we see in Medicare Advantage, the payment incentives to stint on care and other things. We don't want to see that bleed over into traditional Medicare. And the more that these accountable care models are push risk onto the providers, there's a greater danger of that. And I absolutely think that's something that we need to tackle and address collectively. But in my mind, the priority has to be on stopping the Medicare Advantage train. So I'll stop there. Again, much has already been said, and thank you again for the invitation, and much respect to my co-panelists and presenters, whom I greatly enjoy working with.
Thank you, David. Wow, what an incredible panel. I know every time I listen to y'all, I learn more and more, and I'm sure that's true for PSARA members and guests listening in. So thank you all for the work you do every day to make this a better world for seniors and the disabled. I appreciate that. And I'm going to turn it back to Karen. We'll bring Karen back in. I know Robbie and maybe others have been passing questions to her so that she can pose to the whole panel. Karen, welcome.
I did get an email from someone saying I have a bad echo. Is that still the case?
You sound fine to me, but
I sound fine. Okay. All right. I'll start with a couple questions, and Jeff, if you want to take turns with me, that would be terrific. Let's see. Kit had a question. He says that the compensation for those who sell Medicare Advantage have a huge fee advantage that incentivizes MA plans over simple, or I would call it traditional Medicare. The cost difference is in the range of I can sell you a policy and make $700 versus $250. Can that incentive be removed? And I would add, could that be maybe considered as part of our level the playing field?
I'd be happy to take a stab at that, Karen. Yeah, I'd be happy to stab. Yeah, absolutely. I think that's a critical point. The incentives, the sales incentives are such that they just push their thumb down in favor of Medicare Advantage. Agents and brokers can get 3, 4, 5 times as much commissions in Medicare Advantage than they can for a sale of a Part D plan. And according to a Commonwealth report, some agents and brokers don't even bother to sell Part D plans. They just focus entirely on Medicare Advantage. So, while a lot more has to be done, I have to credit the Biden administration for instituting more consumer protections than we've seen before. And there's a proposed rule that has yet to be finalized for 2025 that would seek to level commissions for all Medicare Advantage sales and all Part D sales, trying to address the issue of some Medicare Advantage plans being favored over others versus some Part D plans being favored over others, which would help. But the key point would be to equalize commissions between the two, which was not part of the proposal. I think we need to exercise the system, or is that the right term? Not exercise as in exerting effort, but exercise as an exorcist, and get rid of the demon of the financial incentives when it comes to agent and broker compensation and payments. We need to get that out of the system because it's helping drive the privatization.
I agree 100%. About 15 years ago, I went back to visit my folks in Tennessee. And when I got there, a friend of theirs from church was visiting with them, but he wasn't there to check on them as their welfare. He was there to try to persuade them to enroll in a Humana policy. And he told me, but I was still working for a Cigna at that time. And he took me aside and said, it's like shooting fish in a barrel. And that's something I will never forget. And that's exactly what goes on. They work in many ways, often working with relationships through church or what have you. They're presumed to be trustworthy people and are not forthcoming about where their money is coming from. It's absolutely something that has to be changed.
Okay. Here's another great question. Is there specific legislation that any of the panel recommends that advocates to learn about and push that would support level the playing field? In other words, are there anybody out there proposing legislation that you're aware of that would do what we're talking about tonight?
I don't. Maybe others on the panel can give a better answer, but I'm unaware of such legislation today. But what I can say is that our little coalescence is starting to address that, and we're starting to look at drafting something that will hopefully be a rally point for early 2025, if not sooner. So I'm unaware of such a bill. There are bits and pieces of good bills, but I'm unaware of a comprehensive bill that would do what you're talking about. But I am very optimistic that there will be such a thing in the next few months.
Yeah, I agree.
And if I could add on to that too, I would just say that, as Ed mentioned, there's a lot of different pieces of legislation moving around right now about healthcare, about Medicare. And I think there's a danger in us trying to give a whack-a-mole approach. So is there a comprehensive solution? No. Are there a lot of tiny fixes? Yeah. And if we pursued one of those tiny fixes, it might make it harder in the long run to pursue a comprehensive fix. And so I'm, very thankful to be working with the coalescence on trying to come up with a really, big piece of legislation. We'll see what we can do.
I just add that, a couple of years ago, we were in a much better place during the Build Back Better debate. A lot of these things were on the table, not the full range of it, but adding vision, hearing, dental, strengthening low-income protections, expanding Medigap rights. And of course, that all folded, but out of the ashes, we got the Inflation Reduction Act and the prescription drug provisions. But I think that set an important precedent. And if the stars align, maybe we can revisit that and push even further. And for a brief period of time, there was even a discussion during the Build Back to Better debate about reining in Medicare Advantage overpayments and using that to pay for such expansions in traditional Medicare until the insurance industry put the kibosh on it.
I'll just kind of add to that. I think that's right. There are many pieces of legislation, including legislation that would bar these companies from even using the name Medicare in their marketing materials or call it Medicare Advantage. That's not going to go anywhere, but it's a useful messaging bill. The thing that I think can happen, to echo what Spencer was saying, and Ed and David, is to put together legislative language and then try to find members of Congress who will sign on as leads and co-sponsors of it. I think that's the right approach. And I would add, don't have any expectation that anything will pass this year. Not much of anything is going to pass through this Congress. But now's the time to work on it and hope that there will be a congressional environment and a president of the White House will be receptive to it.
Yeah, I've got another good one. They're all good. There's a lot of them. They're all really great. The for-profit health industry is not interested in level the playing field. So how do we combat them when they have access to our healthcare dollars and our country allows these companies using our healthcare dollars to fund political campaigns?
It's a real biggie because they do spend so much money. They convert a lot of the money that we pay in premiums to campaign contributions, to lobbying dollars. They spend so much money funding or even providing funding to Democrats. I was dismayed as I did a tally of the giving of the political action committees a few months ago of the big insurance companies that have political action committees, and a lot of Democrats were on that list. And sadly, the Congressional Black Caucus was number 5 on the list of receiving campaign dollars from the industry. They know what they're doing. It's very, very strategic, very cynical. The reason the word democracy is in my organization's name, the Center for Health and Democracy, is because you absolutely have to address the role that money and politics and influence plays in our political process. It is why achieving the legislation that we're talking about, why it is so difficult. So I know it's hard to find time to think about taking on one more cause, but I can't think of anything else. If you've got any spare time, then focus on doing something about money and politics. They are formidable.
If I could hop in with a couple of other thoughts on that, I echo what you said. The first is democracy is a vague concept to way too many of us, but healthcare, you take your pills several times a day. You go to the doc. We experience that, and it's incumbent on us as the advocacy community, get folks to see the connection between the barriers to that healthcare and democracy as a collapse. So that Wendell's work is really important. But the other thing I'd like to say is it's so easy to get sort of overwhelmed and depressed by the size of the money that's up against us. And since we haven't passed any of the specific things, many of the specific things we want, it feels hopeless and futile, and we can't go anywhere. I'm here to tell you, we've got all sorts of successes. That I would view that ACR Reach campaign. I agree with David that this is not the time to dwell on that. That's sort of a thing that's ending on its own, and the fire in the house is Medicare Advantage and the upper profiteers. But look at what we accomplished with that campaign. That was a great beta test of what happens when we start to pull together. And then now look at what happened this week. For the first time ever, we actually slowed down the Medicare Advantage train. We didn't turn it around. We didn't get it to change tracks. We haven't really done we understand a strategy now. If we want to get rid of the profiteering and the privatization, what we have to do is improve traditional Medicare, and we have to do all this work together. And for the first time ever, we've got that I know of, we've got this huge success of the rates not going up nearly as much. So, and as Wendell told us, Wall Street's telling Medicare Advantage, your day might be over already. So have we won yet? Of course not, but don't be depressed and overwhelmed by how much money is up against us. It still is in some form, at least a partial democracy here. So that's what we're doing tonight.
Yeah. And I just throw one more thing in there. I think journalists play a huge role in all of this too. And many more journalists are covering these issues because they're getting harder to ignore. And many of you have told your individual stories. And I think we need more of that. We need to double down on that. We need to reach the journalists who are covering this. And that is a fantastic antidote to the insurance industry propaganda about how they provide better care, which is more affordable, neither of which is true.
I'll echo that. That is one of the things that is helping to turn the tide here. Some very, very influential reporters are beginning to pay attention to Medicare Advantage in ways that they haven't. I wouldn't call it a sea change yet, but it's huge. It's remarkable.
I'd also just like to layer in one thing Adi said actually towards the end of his life was that we can't ask people in the world, we can't ask activists to do small things and expect a big result. And, I think it's incumbent upon all of us to try to get creative and find ways to bring this campaign, bring this issue to our communities who are consumed in so many other things in life. And so, while I recognize that we're up against a big machine and that activism takes a lot of work, I would encourage everybody on this call to really take time to be creative and think about how can you be a leader in your community? How can you pick up the mantle to get more people involved? How can you talk to elected officials at all levels of government about what they can do about this issue? And I'll also just to kind of double quote Adi, he would actually quote a writer named Rebecca Solnit, and she wrote a book which I think is called Hope in the Darkness. And one of the quotes from that book is, hope is a hammer that you have to pick up and use. And so, when you're feeling down, when you're thinking about the big money in politics, an important issue that we need to do something about, to echo what Wendell said, just remember to pick up your hope and try to use it in a big way.
That's excellent. Thank you. Thank you. Jeff, do you want to take a few questions or shall I continue?
Oops. So I do want to ask this question. Given what Ed said about, democracy sometimes is hard to grasp as a concept for, the average person, but they take their pills every day based, kind of using that premise. It seems clear that Democrats need fundamental issues that cut across the majority of voters, that the majority of voters get. So given that, the question is, would it be useful if we could to get the level the playing field concept into the 2024 presidential election?
Yes, of course. Yeah, without a doubt. And our coalescence is actually talking about that very thing and trying to meet with, the president's staff to have conversations about this being a really winning issue and a winning message for the president to actually address in his campaign. And it is an issue that cuts across to some degree ideology as well, right? two just real simple examples. As I said, I'm here based in Minnesota in St. Paul, and Representative Ilhan Omar, who comes from a very overwhelmingly blue district, but that is in the sort of the heart of her district in downtown Minneapolis, but she has also what you would call purple areas, right, where there is a real mixture of both Democrats and Republicans. And she sent canvassers out door to door, not to have a conversation about her running for office or anything like that, but to just have a conversation at every door, not just knocking on doors that were registered Bs, right? To just say, how is the healthcare system working for you? How is it working for your family? Is it working? And if it isn't, what should it change to make it work for you as a patient, right? That uses the system. And I talked to the lead canvasser, and she said she was overwhelmingly surprised because there were almost nobody slammed a door on them. There were a few people that just were like, I don't want to talk about this, right? But even folks who identified as more conservative or Republican Party were like, Medicare is a good program, and we should save Medicare and we should make it better for everybody. And I remember during the debate of the Affordable Care Act, I was living in California at the time and working out there. And do you remember when the Tea Party folks would come to town halls that, we would have about the Affordable Care Act? And changing healthcare. And there was one lady in the audience who stood up and said, Medicare is going broke. That, it's a problem that Medicare is going broke. And she was probably in her mid to late 50s. And I just looked at her and I said, does that bother you? Are you worried about that? Are you scared it's going broke? Not that it is, but I just wanted to play with that a minute. And she said, yes, I am. And I said, why? And she said, well, because I want it to be there when I'm 65. Right. And I said, see, that's what we're talking about. We're just talking about why wait to 65? Why not have it from, I always say from womb to tomb, right? All the way through. Think about it. If we didn't have to worry about accessing healthcare just when we needed it, not just when we could afford it. And she actually said, you know what, I guess I got to learn a little bit more about this. So I do think it's a winning issue, and we should absolutely make sure that we're all talking about it and that our candidates are as well.
And I think I might add to that, we need to have an offense, also a defense, because of what happened on Wall Street today, because of what CMS did, these guys are going to shift the strategy to the political arena. And we see how that plays out. We've seen how they will say that a candidate is cutting Medicare. They lie, they mislead, but that's going to happen, folks. And we've got to support candidates who are friends of ours, and those who might not be, but could be. We've got to equip them with talking points and support them. Otherwise, they will go after Democrats. They will try to get Trump elected, folks. They will try to change the makeup of Congress. So just know that that's where their money is going to be shifting from now on.
I have a question. So if a person gives up Medicare Advantage, what could they do instead, given a very limited income? I think that's sort of at the crux stuff.
Yeah, that's another thing that needs to be addressed. Right now, it's a challenge for people to shift out of Medicare Advantage into traditional Medicare because of the rules of the road. You might have to probably in most states be subject to medical underwriting, which can make a Medigap policy unaffordable for a lot of folks. That's another thing that should be a part of the leveling the playing field to make it at least available. The other thing too to keep in mind is that Medigap policies may start going up in price. It's as more people enroll in Medicare Advantage, the market is actually shrinking for Medicare supplement policies. It may not be the company's still in the game, but it doesn't generate as much revenue for them as it used to. So they're gonna be trying to figure out how they can make money to meet the margins that Wall Street expects. So there's a lot there, I guess, but and this is something that states can do, is make it possible for people to leave the Medicare Advantage program and return to traditional Medicare and be able to enroll in a Medigap policy without medical underwriting. That doesn't alleviate the expense, but it does make it possible for a lot of folks. But that goes back to what we were saying earlier. There should be no need for Medigap.
Yeah,
Yeah, if I
and
could
just to, so go ahead, Ed.
I was just going to say, if I could hop in, when I first started learning about this issue of guaranteed issue in states that don't have those protections, I was thinking, well, I live in Missouri. We don't have that stuff. I'm going to fight for guaranteed issue to make sure that anybody who wants to get out of a Medicare Advantage could buy a Medigap policy. And the more I thought about that, I thought that would be maybe a little bit of help, but it's a whack-a-mole marginal benefit that would take a tremendous amount of organizing power. And at the end of the day, how many people would you actually help? Because even without medical underwriting, even if you just buy the entry level, try to purchase the entry level price of Medigap when you turn 65, you're still looking at $200 or more a month. And so the people who were most worried about, because they're being hurt by Medicare Advantage, would, even without medical underwriting, even if states did the most they could along that line, they still wouldn't be able to get into Medigap, even if it were required. So would it be a little bit better to have that as a state requirement? Yes, but I would caution against diverting much advocacy energy into that rather than into some of the bigger issues that are more comprehensive and national. Because, we have states that still haven't expanded Medicaid, for crying out loud. It took us decades for some states to even accept Medicaid without expansion. So state-specific solutions are fraught with inequities. Although sometimes that is the way forward. But in this case, I wouldn't divert much organizing energy into that opportunity.
Yeah, and just to briefly build on that, one additional point is that Medicaid could be an option for folks if it's an option for you in your state. And strengthening the Medicare savings programs and increasing eligibility for that is something that could be done on the federal level. But just like the Medigap rights, states do have the ability to improve their Medicare savings programs, including increase income thresholds, lower or eliminate asset tests. I mean, to Ed's point, it's an imperfect and partial solution, but it is one way, at the very least, to raise attention to difficulties that many people encounter and to provide at least a path forward.
Jeff, do you have anything you want to ask? I've got one more that looks good. Okay, so this kind of goes to some points that Rose was making. The question is, unions have in some cases negotiated with private businesses and public employers to adopt Medicare Advantage as the sole choice for their retirees. The money saved by these employers is substantial. So how can we effectively reach out to unions to support our position?
Yeah, thanks for that question. I mean, it's kind of what Wendell was alluding to as well. I mean, whenever I've been going around and talking with retiree councils, whether they are unionized or even just senior groups or whatever, the first thing I say when I start talking about this issue is that none of this is meant to shame anybody, because when you retire, you are on a fixed income. And on a fixed income, you make decisions based on that income, right? And so not unlike what happens to us in labor when we're at the bargaining table for active employees, we're always faced with a choice. And when it comes to this so-called benefit, it is, are you going to pay on the front end or are you going to pay on the back end, right? Are we going to put more money in and have a higher premium and then less for deductibles and co-pays and co-insurance? Or are we going to, on the flip side, have a lower premium and then hope we're well and we don't get into any type of an accident or anything, and we're not going to get suddenly a surprise bill on the back end of thousands of dollars that our insurance isn't going to cover a whole lot of that, right? Because we have high deductible health plans. This is the same sort of thing. And so I try to go at this in talking with unions. It's really about sort of an education. It's like understanding what's happening inside of Medicare that isn't a benefit to any of us, whether you are at retirement age yet or not, right? And to talk about how that's impacting all workers across the board, and that if you can't get behind right at this moment, you know, thinking, but oh my gosh, we couldn't afford to put our retirees right at this moment now onto traditional Medicare with a Medigap plan, then talk to us about how can we win that fight that we are talking about here tonight and getting engaged in that level the playing field. That's why this strategy is exactly the right strategy inside of the House of Labor, because we are not saying to the House of Labor, everybody move everyone immediately out of the Medicare Advantage plans. That's not what we're saying. What we're saying is there is a huge imbalance here, and that imbalance has to be fixed. And if we fix it, then you can do a different analysis of the finances for you as an employer, you as an employee, you as a union, and we can potentially make better choices that way and better educated choices. So I would just offer, as I said when I made my remarks, it's all about education. It's all about having the discussion. And you know, I've talked with unions that have maybe Taft-Hartley trusts, and they provide Medicare Advantage as the plans for their retirees. But when they hear this, they're like, wait a minute, what do you mean they're ripping us off by $140 billion a year? What on earth is that all about? So it wakes people up, and it gives them something to think about. And it seems to be something that they are interested in getting to the bottom of and actually helping us to fight to win the big change. So that's, I guess, how I would answer that question. And there are more and more unions that are really engaged and interested in learning more about this and teaching amongst their rank and file members and leaders on how we can engage in this campaign.
Thank you. I think we're running out of time. I think we've gotten something like 48 questions, and we're just not going to get to them tonight. So I'm going to, Jeff, if you have anything you'd like to add before we do our closing.
There was one final question that one of our executive board members asked, and that was, those of you who have had the opportunity to meet with Secretary PSARA about some of these ideas, can you give a sense of what the general response was?
He was listening, and I think receptive, but also cautious in what he says by necessity, and then also taking into consideration political realities, and also the ability to try to work with members of Congress to get legislation done. And there are things that the administration can and is doing, as we've mentioned before, administratively. But I think I was pleased with the meeting. I think we were heard, we were listened to, we were there with members of Congress, all members of the Progressive Caucus, some of whom said, well, why do we even need Medicare Advantage? Let's get rid of it. And as said before, you know, that's just not going to happen. But I think, at least right now, but I think I was grateful for the chance to have the ability to sit down with him and to have that conversation. So I think that's a big win.
Excellent. Excellent. Thank you. Karen, that's all I've got.
Okay, me too. So, well, I could be here and talk all night, actually, but thank you all so much for being here. I think we learned a lot, shared a lot, and we really appreciate your time and willingness to be here with us. So, for all of you in the audience, if you aren't a PSARA member, we encourage you to join us. We encourage you to look not at our website, but the websites of our panelists here tonight. There's a wealth of information there, ways you can be involved. We'd really appreciate it. We are, again, I urge you to go to our website and sign on to our letter to President Biden. Just fill in the required information and take the letter to organizations you're part of and maybe ask them to sign in too. And while you're there, we have a wonderful primer that Jeff talked about on our website. It's electronic, but it's a compilation of a lot of the people that you're listening to here, some of the articles they put together. So we encourage you to take a look at that and share that with other people too. So thank you so much for being here. We really appreciate our panelists and for you to be here with us. So